You know, it's not okay using someone's mental health struggles as a weapon when you attack them for, basically you don't have an argument against them, so you just say they're nuts. Well, of course, that's what they're doing with Kanye West. His political views, not all that important, but you just hurl insults at him to try to demonize him. It's simply disgusting.
This was an embarrassment. Kanye's mother is rolling over in her grave.
Not only was this a crazy conversation for this White House, this is the kind of conversation that would typically be held between people wearing hospital bracelets.
I don't know if he's open to help, but I just feel like this is a public cry for help, and he's not getting any help.
There was a ranting lunatic in the Oval Office today.
Kanye, back away from the cameras, go get some help, and then come back and make your case.
Get help? Dr. Lemon, why are you stigmatizing people who battle mental health issues? How dare you try to minimize what Kanye is saying because he's open about some of the mental health issues he's had? I think you owe Kanye and everyone else dealing with these struggles an apology, and you need to do better. Don Lemon's actually a good guy. He knows better. Joining me now is Patrick Corrigan, psychology professor and author of the book, The Stigma Effect. All right, Professor. Now, how deleterious is it for anyone in the media, left-wing, right-wing, to exploit another person's medical history, as was done just over the past 24 hours regarding Kanye West?
Reducing somebody's conversation to illegitimacy by saying they're mentally ill is in the same category as a stigma related to racism, sexism, homophobia. It's saying that your message doesn't count because once upon a time you had experience with bipolar disorder or other illness. The stigma of mental illness is not trivial. People labeled with mental illness are unable to get jobs, live independently, get good health care, and it's all because messages like this perpetuate them as being different, worse than we are.
And Professor, it seems like it would deter people from getting counseling. Let's say they lost a parent, went through a difficult time. If they know later on they're going to be described as one of those people who got help. And I as someone who knows a lot of people over the years who've gone through, especially with like death of children, death of parent, gone through incredibly difficult periods of time, we want to encourage people to be able to talk to others, to get help. And to me, in this case, it's mostly liberals, sadly, in this situation, who are demonizing someone just because, I guess, they're in the Oval Office with Trump and throwing in the crazy town deal as a way to demonize him and dismiss him.
Anytime you throw in the word crazy, whether it comes from the left or it comes to the right, it undermines the opportunities of people who struggle with mental illness. And by the way, that's a lot of people. Epidemiology suggests it could be 1 out of 5 people have a serious mental illness. The stigma fundamentally comes from the label. I'm seeing somebody come out of the psychiatrist's office and I know they must be nuts, or coming out of the counselor's office and they must be crazy. And so they're going to avoid those kind of places so they don't get those kind of labels. And they're not going to get the kind of treatment you were just talking about that we know really will work.
Professor, thank you so much for your insight.